If your genotype has S or C in it, and the man's genotype has an S or a C, even if it's one, the general advice is that you should not get married because of the risk of that child coming down with the sickle cell disorder, so SS or SC. And we know what it takes when a child has the sickle cell disorder. It's a big lifelong problem. Not to scare you, but prevention is better than cure. Bone pains, blood transfusions. Sometimes they can lose their spleen. They're one of their organs to just start disappearing. And the organ plays a very important role in preventing the development of many infections. But my question is, two people have gotten married and they both have the S. What are they going to do? Are they going to separate? Are they going to go their separate ways just because they have this? What can be done? That's what I'm going to describe in this video because there's a way out. This is the video you want to be watching because I'm going to share very important tests that you can do to sort of guide you as to the genotype of that baby. And you can take this decision in your hands. Hi, I'm Dr. K. I talk fertility, female reproductive concerns, and safe pregnancy. So this is a safe place for you. This is where you get evidence-based medical videos that help you in your decision making. So stick with me, okay? Comment, like, share, subscribe, so that once I drop these videos, you can be notified immediately. What can be done? A man is AS, a lady is AS. They know that the chance of having a baby with the SS gene is there. Each pregnancy, there is a chance that the baby could come down with the SS gene. What can they do? Number one, there is a test called NIPT. It's non-invasive prenatal testing, non-invasive pregnancy testing. What we basically do is that the lady is pregnant, we take your blood, and then we can predict the baby's genotype using your own blood. It's highly accurate in climes where they know what they are doing, where they know how to check it. It can be very accurate in predicting. I've seen many cases where it did predict it quite well. Okay, so they come back to you and then they tell you what the baby's genotype is. Now, what is the advantage of this? The advantage is that it's non-invasive. We are not doing so much for you. It's just like going for a normal blood test, syringe, needle, they take your blood and check it. The disadvantage is that sometimes if it's not done well, if it's not done in a proper lab, they could give you a wrong result. Number two is that if they come back and tell you that that baby is SS, what will you do? So you are now locked up in a decision to possibly terminate the pregnancy, abort the baby. This is one thing that you want to be thinking about. The second test, which is more predictable than this test I've just mentioned, is before you get pregnant, both of you. Before you get pregnant, you can go to a fertility hospital and a fertility lab, and we can do what we call pre-implantation genetic testing. So this is like IVF, okay? We get the sperm, the egg, we join it, it forms the baby, and then we check we can form many babies, and then we check each of the babies, check the one that does not have the S, and then transfer it to you. So very similar to IVF. And then you don't get a baby that has the SS gene, that has the sickle cell disorder. What I need to tell you guys is that these tests are very expensive. They are not cheap. So it's something you might want to consider, okay? The advantage of this second one I've just mentioned is that it's highly accurate. Okay, most times, in fact, I've never seen it fail. That's the truth. Disadvantage is that it's sort of invasive. So you are going for like IVF, they stimulate your eggs, egg collection, embryo transfer, and it can be very expensive. So these are things you want to be considered. If you're already married, if you're already together, or you're planning and you think you have the funds, then you can explore that option so that we don't just leave you hanging and for each pregnancy you are guessing, now we are praying, let's not have SS, no. We are putting the decisions in your hands and then empowering you to know that something can still be done. I wish you all the best.